Following the success of my video on forward head posture, I'd like to do another one now on lumbar herniated disc. This will be a bit different in the sense that it will not be a real protocol where I tell you about session 1, 2, 3, 4, 5, but I will tell you about steps, and each step may take 1, 2 or 3 sessions. It depends really on the evolution, on the severity. Furthermore, what you're going to see here is the posture therapy approach to a lumbar herniated disc. It does not exclude anything that your doctor or your PT will tell you. If your surgeon thinks that you need to go through surgery, well, I'm not the one who will tell you yes or no. 1, because I don't know your medical file. 2, because this isn't my specialty and I don't want to take responsibility for such heavy decision. So what I'm going to show you is what you can do to avoid putting oil on the fire so that really your condition gets better as soon as you can and that it doesn't come back. Okay? To do that, you really need to understand what a lumbar hernia is, and therefore we will start by a bit of biomechanics. Look, I'm going to do a lumbar hernia for you. These are 2 vertebrae, and now I'm going to press them together and pop, here comes a lumbar hernia. You see? Again, hop, pop, lumbar hernia here. So what did I do to achieve this great thing? Well, I did make a round back, yeah? This is forward flexion, so it's kind of like this, yeah? And then I pressed, okay? I needed the 2. Therefore, a lumbar hernia is, from a biomechanical perspective, the result of round backs plus vertical compression. We're going to come back to what creates one, one creates the other. The other factor that will facilitate the lumbar hernia, or actually any hernia, is when the outer part of the disc is overused. You can see the disc as some kind of, say, ring, a fiber ring, which is full with some kind of jelly stuff, call it water. Yeah? If the outer wall is weak, well, the inside will go out quicker. And this is why the solidity of the outer wall is also something that we need to consider. What will wear off the outer part of the disc? Well, repetitive torsions like this. Okay? In your lower back, it's something that we see typically in people who do manual handling, but in the neck, which is not the topic of this video, it's typical of something that we see when people have 2 wide screens next to each other. Yeah? It has to come in the discussion on the ROI, return on investment, of having a dual screen. This being said, let's look at what creates the round back, the compression, and the torsions. Round back can be round back from above. That's, for example, because I'm going to take my baby from the cradle like this. Or because I bend forward, say I'm a dentist, for example, or I'm a dental hygienist, and I'm leaning forward on my lying down patient. Slouching is also typically what happens when I slide in my seat. There are many reasons why I slide on my seat, but that's another topic. Now let's move to compression. Where can compression on the vertebrae come from? Well, there are 3 origins. Either from above, that's your own weight plus the weight of what you carry. That is why when you have an overweight problem, one of the treatment solutions may be to lose weight. Compression can also come from below. That is typically the shocks that you will have when you do parachute jumping, or the smaller shocks that you're going to create when you jog on the asphalt. And more than everything, compression can come from the 2 at the same time, above and below. What I mean with that is that you see the muscles that attach to the vertebrae attach to 1, 2, 3 levels. So they are muscles that run vertically along the spine. When these muscles are tense, well, the result of muscle strain will be spinal compression. Hence, we also need to look at why would muscles be too contracted. And there are two main reasons. One, because you misuse them. Two, because you're stressed. And you see, the annoying thing is that whereas round backs were fairly visible, I mean, you can see if you can bend forward, you can see if you slide in the seat. Compressions from above and below are also relatively easy to grasp from the outside perspective. Well, muscle contraction will be much more difficult to assess. We really need to look at what you do with your back muscles day in, day out. The last biomechanical factor that we need to look at is the torsions, but again, this is fairly visible. I mean, there's a simple trick, is you look at the line of your shoulders, you look at your hips. If your shoulders are not facing the same direction as your hips, well, you know that there's torsion, and this torsion is both in the lower back and in the neck, because the mid-back isn't able to move so much. That's to protect the lungs. So to cut a long story short, the causal treatment will be about fixing these biomechanical factors. Where does round back come from in your life? Where does compression come from in your life? And especially, where does the combination from the two come from? Plus, where comes torsion from? So this is for causal treatment. Next to that, we need to discuss symptomatic treatment, which is the topic of the second half of the video. And what you're gonna do is really gonna go on the two parallel tracks, each one at its own speed. We're gonna do causal treatment at the same time as symptomatic treatment, and move the two forward until you feel better. The idea is not that you do everything perfect. Nobody can. I don't even do everything perfect with my body. The idea is that we find the right balance between what your body can bear and what you do with it. And what it can bear is, for now, as you're injured, less than it will be in the future. So we need some time, your body needs sometimes to recover and to recondition. The goal is that you use this recovery time to learn how to use your body properly, from unloaded to progressively a bit more loaded, and that little by little you learn how to remove everything that has caused the hernia. Of course, I'm in this case talking about hernia which are due to a cumulative phenomenon, i.e. small things that you have done all your life long. I'm also talking about hernias that come due to an accident, for example, a car accident. Well, it's true that the causes are long gone, but as everybody, you do have a tendency to slouch, to have your back compressed and everything. And although this may not be the direct cause of your herniated disc, it's what we call a perpetuating factor. So it's oil on the fire. Yeah? And therefore, we will treat accidental hernia in exactly the same way as we treat cumulative hernia. Before we dive into the program, I'd like to tell you more about how it's built. The reason why I want to tell you this is that a lot of the patients that I have lack a clear strategy, and therefore they feel lost. They don't know where the hernia came from. Their physical therapist gives them some exercises which sometimes are good, sometimes are less good, but they don't see clearly the relationship between what they're doing and where they want to go. Plus, what's often missing in the usual treatments is daily activities. Hernias are often treated at a purely symptomatic level, like if they would be due to things which do not belong to your life anymore. And this is unfortunately very rarely the case. So let me tell you about the structure of the protocol that I have for lumbar herniated discs. There are two pathways. One is the causal pathway, the other one is the symptomatic pathway. Yeah? So the first one is related to what you do in your daily activities. The second one is related to exercises that you do. Exercises are meant either to help you feel better or to teach you the skills that you will need for your daily activities. Okay? Therefore, there's a need to synchronize these two pathways. The pathway of daily activities goes from simple to complex, from static to dynamic, from light to heavy. There are 4 steps: how you sit, how you stand, and actually how you walk, how you bend down, and how you lift. Next to that, we have the symptomatic pathway. When we deal with sitting, emphasis is on how to decompress the spine. There are 2 reasons for that. Number 1, sitting is a massive source of compression. 2, decompression is the first urgency. We first need to free the tissues. When talking about standing, then the issue is more related to what I do with my pelvis. And if I want to master that well, I need to do 2 things. 1, make sure that my pelvis moves well, that it has the ability to rotate in the 3 geometric directions, X, Y, Z, plus make sure that once you know how to rotate in every direction, you know how to control the position, whatever be the position of your body, sitting, standing, kneeling, lying down, etc. That doesn't mean, of course, that we stop decompressing, We will always decompress, even after the treatment. After all this is okay, well, we actually will only focus on the daily activities for the bending down part, but this is a short part. And then comes lifting, and of course with lifting comes the idea of strength. So strengthening your back is not the first step of the treatment. It's the last step of the treatment. Before strengthening it, we have decompressed it, we have mobilized it, we have learned how to control it. If you don't do all these 3 steps before you strengthen, you're just gonna stiffen, because strengthening exercises have a stiffening effect. You will stiffen around postures which are unhealthy and which most probably have caused you health issues. Unless we have a very, very good reason to do otherwise, we're always going to start the causal treatment by how you sit and how you slouch when you sit. Why that? Well, because most people do sit a lot, and therefore it is an easy, say, introduction into pelvic control. Typically, if I sit on a chair like this, you see that 2 things happen. Number 1, there's nothing to hold my belt, so this is slouching. Number 2, I slide in the chair. So this is also creating slouching, this time from below. For example, we'll say, okay, let's put here a lumbar support. And let's put here a small piece of anti-slip mat so that you don't slide anymore. On your office chair, we're going to look at the position of the lumbar support. Typically, if the lumbar support is too low, you glide in the chair. But we're also going to look at how does the backrest angle look like. You see that if the chair brings you further away from your workplace, you're going to bend forward, and this is called slouching from above. I'm definitely going to look at how you drive your car. If the backrest is very much backwards, again, you're here. If you have leather seats, chances are big that you slide in the seat. Definitely, I'm going to look at what you do with your couch. Most couches are too low, which puts a lot of pressure in the hip joint and makes you slouch to feel some comfort again. Couches are also too deep, and most of them don't have a lumbar support. So you see on this one, if I want to sit well, I put a cushion to shorten the sit depth and a lumbar cushion to stabilize my belt. So this is how you will, say, improve the ergonomics of your couch. I will also ask you if you read in bed. You see, if I read in bed or watch a movie, again, my back is round, so this is slouched from above. I know that it's rather usually in the upper part of the back, but whenever there's tension in the upper part of your back, the lower back suffers as well. And you see, as we're talking about you, we should also be talking about your family and what you're teaching them from your experience. This is a small piece of anti-slip mat that I use in the push cart of my son, so that he doesn't slide in it and doesn't take the habit of slouching whenever he sits. Of course, I'm going very quickly through the discussion, and you should check out the playlist that I have on my channel to really get into the depth and the subtleness of how to sit. But basically, once I have helped you improve your sitting posture, the next topic is how long do you sit in a row? And my advice will be that you should never be sitting for more than 30 minutes in a row. Every 30 minutes, you should get up. And that will help not accumulate compression in your lower back. Compression on your back is actually like sugar on your teeth, you know. You have learned from your parents that you shouldn't eat too much sugar. And you learn from me in step 1 that you shouldn't put too much compression due to sitting on your back. Well, but your parents also told you that there's always a bit of sugar in life, and therefore next to not eating too much sugar, you should also brush your teeth. Well, you're gonna hear the same from me. After I told you all the techniques to not put too much gravity on your spine, I will teach you how to decompress, i.e. how to remove the effects of gravity, which is called how to decompress. The first decompression exercise that will suit all patients with a herniated disc is a very well-known exercise, but it's extremely effective provided that you do it extremely frequently. And this is a key thing on the exercises, is that frequency matters much more than duration. The reason for that is that compression, as well as muscle tension, as well as tends to be an exponential phenomenon. So if you try to control it once you're up there on the exponential, forget about it. Whilst if you exercise extremely frequently, you manage to remain at low levels. So let's look at how we decompress the back. You're going to lie down on your back, not necessarily on the hard floor like I do. You can put a yoga mat, or you can even be on bed, provided that it's not too hard. And even you can use a pillow for your neck, okay? And the idea of the exercise is that you bring one knee in direction of your chest with the lower leg horizontal, and then the other knee. What I mean with "and then" is I don't want you to lift your two knees at the same time, or your two legs at the same time. This is always forbidden, even when you're healthy, because it's way too heavy on your back. Therefore, one and the other. The exercise is also easily done when you come back from work, you had a long day. You just lie down on the floor, on a carpet like I am, with your calves on the sofa. And you wait for 2 minutes, 3 minutes, and your back is decompressing. So very easy, very pain-free exercise, but very effective exercise. At some point, you'll also be able to use a gravity-assisted version of this spinal decompression, which is a lower back stretch. I'm showing you the exercise, but wait until the end so that I explain you how subtle the exercise is. This is basically the exercise. You see, here I'm stretching my back, and we have seen that muscle tension in your lower back is a source of spinal compression. Two things that are extremely important for this exercise. Number one, when I do the exercise, my shoulders are resting on my knees, and therefore there is support for my upper body weight. It's not like my whole upper body weight is hanging on my lower back tissues. If I can't go down too low, well, I just go like this. Number two, you have to really beware how you get up, because when getting up, if you use your lower back muscles too early, you're gonna ask them to raise your upper body and therefore contract, which your disc is not ready to bear. Therefore, there are different ways to get up. You can use your arms like I'm doing now and push on your arms. If you do that, your lower back muscles haven't done anything. At a later stage, the idea is not that you use your arms, the idea is that you bring your lower belly inwards, which will protect the lower back by increasing the pressure in the abdominal cavity. and that you rotate on your pelvis, i.e. on your sitting bones. And that requires basically your lower abs together with your glutes. So when you master your pelvis well, you manage to raise your upper body without using your lower back muscles and therefore without compressing your spine. But that takes a bit of time, so this version of the exercise is not what you do in the early stages of the treatment. Step 2 to fix the causes is standing. For many of you, it will not be that intuitive to think that we should fix standing where we're talking about issues that are caused by a slouched back. But I told you that the problem is when the back is round and compressed. And one of the big sources of compression is muscle tension. What I didn't tell you is that muscle tension does not disappear at the moment when you stop the contracting activity. In other words, when you contract your back muscles, they take some time to relax. And if during this time you happen to have a round back, there you go with round plus compressed. So we still need to fix all the sources of muscle misuse in your back, and that includes standing. That includes standing because most people will be standing like this. For ladies, can be on high heels with this variant, but basically most people are standing with a hollow back, and a hollow back is muscle tension in your lower back. Therefore, we need to go through the whole process of learning how to stand properly, which you can see in detail in the video on forward head posture, which is linked below in the description. But to cut a long story short, we start with how you put your weight under your feet and how you place your feet. So your feet should not be pointing outwards, which pushes your belly forward. They should be facing forward, i.e. parallel to each other, and your weight should be under the arch of the foot, split 50-50. Then the next level is working on your knees, making sure that your knees are not locked, neither locked on the two sides nor locked on one side, obviously, because this is violating the 50-50 distribution. Then we work on the position of the pelvis, which is not here, but there. And for this, we have what I call the penguin test. The penguin test is if you do this with your arms and hit your thighs while your pelvis is too far forward. When you do this, your arms should cross just in front of your hip joints. And when your pelvis is at the right place, well, still the hardest part is to come, because we need to work on pelvic tilt. And this is quite complex. Again, in the video on forward head posture, there's a full 4-step process to master that. But what you'll see is that at this stage, we need some pelvic control, and therefore the project on the causal treatments meets the project on symptomatic treatment, because I'll tell you in a few minutes that in symptomatic treatment, I need to work on pelvic control at step 2. So at this stage, you know how to stand properly. What we still need to teach you is how to walk and how to bend forward with a flat back. Okay? Once you master all that, the topic standing posture can be put aside and we can focus on bending down. To stand properly, you see that you therefore need proper pelvic control, and that includes mobilization exercises. Mobilization is about creating or recreating mobility. In other words, we're trying to go against the tendency that your spine has to block itself due to the pain. So the exercises we're going to do are very slow exercises, always within your comfortable range of motion. Otherwise we create pain, therefore more blockages. And the exercises need to be repeated very, very frequently. It's not about the number of reps, it's about the frequency. We start lying down because there's no weight on the tissues, then we go on all fours because there's no weight either. Always the same. You can lie down on a yoga mat and with a pillow, no problem. The exercises we're going to do are twofold. Number one is going to be hollow back. You see that I can fit my hand under my spine, and flat back. Now my lower abs are engaged as well as my glutes. Okay, so just hollow and flat. Number two will be a lateral movement. This lateral movement is I bring my hip to my shoulder and the other way around, always with a flat back. So your lower abs stay engaged throughout the whole movement. So you see, this is a lateral flexion at pelvic level. I'm gliding my lower back laterally on the floor, not too quick. This being done, we're ready to move on all fours. The point of going on all fours is that we still have no weight on the tissues, but we have more mobility. And now we're going to do something that scares a lot of you. But this fear that you have is the very reason why you develop persistent or chronic pain. Because fear of movement is called kinesiophobia. It creates contraction. Contractions create compressions and perpetuates the symptoms. So we need to do this, but we need to do it very slowly and within your range of motion. So if the movement is at first only 2 millimeters big, I'm happy with that. Next week will be 4, the week after will be 8, and in so many weeks you'll be able to be flexible again. But we go very, very slowly. Okay, this is the famous cat-cow exercise, but many people don't know that it has 6 variants. Variant number 1, the one that you all know. It starts in the pelvis, it finishes in the neck. Okay? Variant number 2, this is aiming precisely at your lower back. So if I open my knees, I'm acting lower in my spine. Variant number 3, well, conversely, if I go like this, I work more in my upper back, and the range of motion is super small. Variant number 4, the one that I call the happy dog, which is the equivalent of what we've just done lying down. So it's I bring my left hip to my left shoulder, and conversely, my back is always flat, like it used to be. And the variant for your lower back is here, in which it's not easy to not have a hollow back, so I really have to control it properly. And here we go. And then here, the variant for the upper back. This exercise, which I've just showed you, the 6 variants on all fours, belongs to Mr. and Mrs. Everybody's daily hygiene, even after you feel better. I still do this exercise several times a day. So this is about recreating mobility in the spine. So after we have recreating mobility in the spine, we use this mobility for another purpose, which I call control. Control is about creating all kinds of weird movements and making sure that you can misplace your pelvis or place it properly. For example, I can make you have a flat back standing and make sure that once you bend your knees, you keep your back flat. And make sure that you can make it hollow, which is wrong, round, which is wrong, or keep it flat. And we'll do the same to make it more complex with the feet offset, for example, or with your trunk a bit more horizontal, or etc. It can be on all fours, it can be kneeling, it can be lying down, it can be sitting, it can be standing. We just do our best to be super inventive in terms of weird positions and make sure that you control your pelvis. And this is actually an essential step before you do anything like the plank or the bridge exercise. If you don't control your pelvis super well, you will do mistakes. Let me give you an example. For a lot of physiotherapists, treatment of a hernia almost starts by the plank exercise, which is, in my opinion, completely mad. Look, first of all, it's a very heavy exercise. But secondly, if you're not able to do the difference between a hollow back, a flat back, or a round back, why would you start lifting a leg and do crazy things like this, you know? You don't master the basics. Same with the bridge exercise, you know? The bridge exercise should be done with the flat back, and you should keep your back flat, which defines the limit of the exercise. But if you don't understand this limit and do not control the limit, you can do it with a hollow back and go crazy high. But this isn't a healthy exercise anymore, okay? So this pelvic control thing is definitely a crucial skill to protect your spine, and it's something to master slowly before doing complex / impressive exercises like the ones I've just showed you. There are only 3 techniques to bend down. Each one of them has a certain context for using it. It depends on the weight of the load as well on where it's placed. So let's go down to the garden so that I can show them to you in real life. Technique number 1 is technique on one foot to pick up light objects directly from the ground. So for example, here is a small shovel, yeah, up, up. You see, my back has stayed flat because I had this synchronization between the leg and the trunk. For things that are heavier, I have another technique on 1.5 feet, which is bring a foot back. And then the interesting discussion is, how do you get up from that? There are 3 possibilities. Possibility number 1, I push on the rear toes, bring my body forward, and I get up over a few meters. Possibility number 2, which I would not recommend for heavy loads and if your discs are still a bit fragile, which is this rotation here. That works fine, but your feet, pelvis and shoulders needs to be well synchronized. This is why we had the discussion earlier on coordination, but this one is really complex coordination, so we'll take it easy. The third technique is a simple one, yet a bit counterintuitive, is when I'm here, well, I can take a stronger object and just push on it. And you see, if I push on it whilst keeping my pelvis back, the push is going to make me stand up. Of course, this isn't valid if you have something in your hands. The very last technique for manual handling is, after being on 1 foot or 1.5 feet, is being on 2 feet. And to be on 2 feet, I'll have my feet parallel, preferably. In some context, I can have them slightly angled, but I have to be really careful with the position of my pelvis. And I'm going to bend on my knees. And you see that I can't bend any lower than 90 degrees, which means that this technique isn't suitable for any load which is below your knees. And this is what most people don't know. As we reach the end of the process, we're ready to discuss the most complex topic of all, which is manual handling. In manual handling, I put everything which involves a physical effort, whether in a professional context or in a private context. In other words, we'll also be talking here on how do you carry your children. There are 3 topics when discussing manual handling. Topic number 1 is strategy. Then it is posture. Then it is cladding. Strategy first. Many people think that the golden rule of manual handling is bend on your knees. And as you can see on this picture, bend on your knees is definitely not the golden rule. This guy is first unstable because he's only resting on his toes, then he's messing up his knees due to excessive pressure, due to a too close flexion angle. You see that the lower back is round and compressed, so he's actually creating a hernia now. He's also messing up his neck due to the correction of the line of sight, and the load is at a distance from his belly button, which makes that when he gets up, the load is far away in front of him. So you see that this is totally impossible with a heavy load. So strategy matters, and strategy is not about bend your knees. Strategy is about how will you lift, push, pull, whatever, as little as you can. So we will discuss about how can you avoid getting into manual handling situations, but also what lifting aids can you create. Sometimes it's fairly simple to carry the rabbit's house, which is here behind me. Well, I've just developed 2 planks like that, so I put the house on the planks and I pull. So strategy is about not lifting and about using aids. Then, once we know that we do have something to do with our body, what we'll do is discuss the best techniques to bend down. So we will review strategy and posture in all your daily activities that involve physical effort. We will go to your car and look at how you put the child in the baby seat. We'll go to your home and look at how you, say, take the clothes into or from the washing machine. We'll look at how you empty the dishwasher. We'll look at all this stuff. And finally comes the issue of cladding. What is cladding? Cladding is about creating muscle contraction. It's probably the first time in the video that you hear me talk about contraction. And this is very specific because basically whenever you have a load in your arms, what the impact of the load will be to distort your position, i.e. bring you into deviated postures, and this we don't want. Therefore, we need to prepare the body for the physical effort, and that goes through some level of muscle contraction so as to create rigidity. And this rigidity has to be balanced with the need for movement. So there are 3 areas which you can rigidify depending on what you do. Number 1 is your legs, that will stabilize you on the ground. Number 2 for pelvic control is lower abs and glutes. And number 3 is what I call the M, which is the combination of the latissimus dorsi and the lower trapezius, which aims at rigidifying the upper body, avoiding this. Okay, so depending on the context, we will use 1, 2, or 3 of these areas, of these muscle groups, so as to stiffen the body so that it does not bend under the effect of the load. So you see that this is really quite a complex topic which covers everything that we have discussed previously, and this is exactly the reason why it goes at the end of the program. Last but not least, after manual handling, we need to, say, reset the body because strain has accumulated on it, and this is probably the moment when I'm going to show you the famous upper body reset. Before was a bit too early because your tissues were a bit fragile and you were not mastering well the coordination between the pelvis and the spine, but probably now is time. This upper body reset goes like this. You shake your wrists, then you throw your thumbs, then go on the elbows. So you see I'm relaxing every joint one after the other from the extremities to the core. Now I'm dealing with my shoulders and now at the neck. For now, nothing is risky for you as a patient with a lumbar herniated disc. Now we're going into a bit of a tricky area when we're adding this torsion in your back. So you see it has to be very gentle, and we don't want this movement too early in the process. We don't want the next movement too early in the process either, which is flexing your spine forward and stretching it. Here, I'm going to do 2 things. I'm going to bring my lower belly inwards, and I'm going to inhale so as to first turn my pelvis and then straighten the spine. And you see, this helps me moving upwards again without overloading the spinal extensors, therefore without creating compression on the spine. But again, as you have a long history or short history of disc pain, this is something that comes to the end of the treatment. Don't try that right the first time when you're seeing the video. Last step of the treatment is strengthening. What do you need to strengthen? Well, your legs, your lower abs and your glutes and your lower back muscles, as well as the M and therefore the lower trapezius and the latissimus dorsi. I will focus on this video on how to strengthen the spinal extensors in the lower back, because this is something which I think is often wrongly done. What's wrongly done is a lot of exercises are concentric exercises, meaning strengthening exercises that will shorten the back muscles, and these are not good because they create again this compression that we don't want. So the idea therefore is that we go hollow, flat, and that we just bend with the flat back. So you see, we're basically adding our body weight to the load on the low back muscles, but the back is flat, i.e. the load, my weight, is distributed across all the tissues. And when this is too easy, well, then I start adding weight, for example, by having my arms forward, yeah, and I can have a light weight also between the shoulder blades. And what matters a lot is how I go back from this position. You see, this is why we need to talk about coordination. So what I'm going to do is have a hand in my lower back, the other one on my lower belly, and I'm going to make sure that my pelvis tilts so that I can get up with a flat back. So you see, strengthening should be done only after coordination. And of course we can talk about many other exercises, but I think that this is quite crucial. For exercises regarding strengthening the M, check out the video on forward head posture. There is always a debate on, do you need to strengthen your abs, la 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 la. My take on that is that if you use them 16 hours a day, they will get stronger. So you see, many therapists see strength as a cause of good health. I don't. What I see as a cause of good health is proper muscle and joint use, i.e. proper posture. And the fact that you use your body properly 16 hours a day, because there are 8 to sleep, will reinforce muscle that needs to be reinforced. You can, if you like, do a few exercises to complete the job, but using your body properly throughout your daily activities is enough strengthening, in my opinion. I'd like to conclude on the observation by experience that many people have long-lasting pain because the causes of the hernia are not being resolved. A lot of therapists treat you like you would have had an accident, i.e. like the causes would not belong to your daily life activities anymore. And this isn't true. Even if you've had an accident, I'm 100% sure that there are some things in your daily life which before the accident were not causing any problem, but now are fueling the pain. And therefore learning how to use your body is, in my opinion, an essential step to recovery. So what can you do with this video? Of course, I understand that it's a compact video, you know, it's just a few minutes to cover months of treatment. So that will not be enough for you to resolve your pain. It will be enough for you to understand that there is a given problem, biomechanical problem, and if you have understood this biomechanical problem, you can lay out a strategy, a structured approach to fixing the causes. And as the body is meant and designed to recover by itself, it will help you if you help it. In practice now, to be very transparent and very honest with you, I lack time to treat all the people who come to me. Therefore, my preferred way of working together is to discuss with your therapist, because once your therapist is trained or say made aware of additional steps to the treatment, well, he or she will be able to treat more people. Now, although I would prefer to avoid it, I can be run over by a bus tomorrow, and therefore no one, neither you nor your therapist, should depend on me. So this video is really a video that aims at other people's empowerment, and if I can help with that, I will gladly do so.